I mean, Osgood-Schlatter disease is very common within football, and I think within a lot of sports in the younger age group, in the academies. Basically, in simple terms, it's a reaction where the patellar tendon inserts into the tibia, the shin bone. As I say, over a period of time, it tends to get worse and worse and worse, and you get this kind of pulling of the tendon at the growth plate, and that's what causes you the problem where the tendon attaches. It's so much related to activity in terms of how much training you're doing will have a massive effect usually on whether this happens. I think growth has a large effect on this as well, and you'll see players that are shooting up and getting taller, and that's when they tend to get their reaction, or during either the early stages or the late stages of that. So I think for me, Osgood-Schlatter is very much related to training amount and to do with growth and growth spurts that children get. But it can be very painful and very, very debilitating. You know, I think you can miss a lot of football through it because it is very sore. Because basically for me, that area can't cope with the amount of strains and stresses that's being put through it. Now, especially when you get to a professional academy level, it's not just more training, but the intensity of training is so much higher, and everything's quicker and goes on for longer, that I think that you know, if you are prone to pain in that area, it's definitely gonna cause a problem. Treatment-wise, first of all, you're going to try and get the area to calm down. So you would use your usual principles, especially when you get the first episode of pain, in icing it, and you know, maybe using compression just to try and let the area just settle. The main thing for me out of all of those, though, is rest. And what you have to do is adjust the amount of training load that's going on. So that, for me, is the most important treatment of and education. Educating to the child, or educating to the parents and/or to the coaches. And that's, for me, is the most important treatment. If you get that bit right, often you can manage the condition. Because what you'll do is when the pain has settled down, then what you'll do is you'll then train, you know, your usual levels, and you'll train normally. When it gets to an area where it's inflamed, you'll then calm down a little bit. Then you'll go back, and when it settles down again, you'll train. And that will be the pattern that quite a few children will do for years and years and years. And they can still improve technically, and they can still get enough training inside them so that you know, they've still got a chance of making it as a footballer or as a professional sportsman. But I think what you need to get across is, you know, if you keep pushing and keep pushing and keep pushing and ignore it, or just keep pushing through the pain, you could end up in a scenario where it becomes so painful and such a problem, you might end up missing 12 months, 18 months. That potentially could end up the chances of that boy getting a career in football or rugby. So if you can manage it and go in and out and in and out and in and out during the periods where it is at its worst, I think you've got a better chance of actually getting on top of the condition. So that, for me, is the main treatment. It really is advisory. I think in terms of stretching the muscle, yes, in a theory you are going to try and push it to get the length into that muscle. The only problem with that is, yes, you're going to lengthen it, and you're going to get the stretch within that muscle. But for me, the fundamental as well is the fact that that muscle hasn't got the strength. So, okay, you're going to get the length into it to match the bone growth that you've got, which is great. And so therefore, if any of the pain is being caused by the fact that the muscles are too tight, and therefore when the bone is growing, it's basically making that muscle go really taut, then yes, I think you've got to have stretching into there. I think what you've also got to appreciate at the same time is that, yes, although the muscle's got to catch up in terms of length, it also has to catch up in terms of strength as well. And if it doesn't catch up on both of those fronts, you could get both pain from either side, really. So I think stretching is very important, and in the adolescent, it's very important to gain flexibility as your bone grows. I think in terms of flexibility wise, I think sometimes there can be too much of a push onto it. I think what you've got to do is just keep matching the bone growth all the time so that your muscle stays at the right length, and then you allow however long it takes for that muscle to develop the right amount of strength within it to be able to cope with the load for the next growth spurt of bone.